Administration of suppository is a new skill added to NMC OSCE. Time limit for this station is 10 minutes. Moreover, this will be one of the 6 skills added in NMC OSCE from November 14, 2022. Thinking of how to perform this station? This video is your answer. You will be provided with a mannequin for the procedure, and the examiner will be giving voice-over for the patient. Like any other skills performed in NMC OSCE, this skill can also be divided into 3 phases, which are introduction phase, procedural phase, and post-procedural phase. Let's see one by one. In this phase, you will introduce yourself, explain the procedure, and gains consent. For example, you can go like, "Hello, my name is Miss X and I am the nurse caring for you today. Can I confirm your name, please? What's your date of birth?" Confirms this with the ID tag. Following this, you need to tell the patient, "I am here to administer the suppository prescribed by the doctor for your constipation issue." Gains consent by asking, "Is that okay with you? Can I proceed?" Ensures that a bedpan, commode or toilet is readily available, or verbalize that "I have kept bedpan/commode/toilet. Depends on scenario, ready to be used after the procedure." In procedural phase, you will don a disposable plastic apron and non-sterile gloves. Verbalize that "I would request or assist the person to lie on their left lateral side with knees flexed, feet level or slightly raised, buttocks near to the edge of the bed." This is because the mannequin should not be moved into position for health and safety reasons. You will place a disposable incontinence pad beneath the patient's hips and buttocks. Now, before administering any prescribed drug, you need to look at the person's prescription chart and checks that all of the following are correct. Right person, checks ID with person. Verbally, against wristband, where appropriate, and documentation. Right drug. Right dose. Date and time of administration. Right route and method of administration. Right diluent as appropriate. You also need to ask the patient about allergies. Check validity of prescription and signature of prescriber. Make sure that prescription is legible. If any of these pieces of information is missing, unclear, or illegible, you should not proceed with administration and should consult the prescriber. Prior to inserting the suppository, verbalize that you are observing the anal area for evidence of skin soreness, excoriation, swelling, hemorrhoids, rectal prolapse, or infestation. Moving forward, you will place some lubricating jelly on gauze square and lubricates the suppository. Separate the patient's buttocks and inserts the suppository using the correct end, referring to the manufacturer's instructions, advancing it approximately 2 cm to 4 cm. Repeats this procedure if additional suppositories are to be inserted. Post-insertion, you need to clean any excess lubricating jelly from the patient's perineal and perineal areas using gauze squares. You will also ask the patient to remain lying down and retain the suppository for about 20 minutes, or until they are no longer able to do so. Also, inform the patient that there may be some discharge as the medication melts in the rectum. Verbalize that you would assist the patient into a comfortable position and offers a bedpan, commode, or toilet facilities as appropriate. Maintain patient dignity by arranging the bed covers to keep the patient covered as much as possible during the procedure, and replaces patient's bedclothes and covers once the suppository has been inserted. In post-procedural phase, you will dispose waste appropriately and cleans any equipment used. Cleans hands with alcohol hand rub, or washes with soap and water, and dries with paper towels following WHO guidelines. Verbalization accepted. Date and sign medicine's administration record. Reassure the person appropriately. Closes the interaction professionally and appropriately. To conclude, suppository administration is one of the simple skills you can get for your skills station in NMC OSCE. A detailed article on this specific skill can be found on our website www.oscetrainer.com. You also can buy our OSCE guide from Amazon.com. For this you need to search for NMC OSCE by Lovelin Joshi. Please like, comment and subscribe our channel for more informative videos on NMC OSCE. Thanks for watching.